You're listening to the Road to Wisdom podcast, weaving stories told by wonderful minds about all things motherhood, health, intimacy, politics, nature, and everything in between.
Join us on an adventure discovering unique experiences that we can learn from to enhance the ways in which we live.
We are your hosts, Chloe
and Kashia. Welcome everyone to the Road to Wisdom podcast. Today we have Yaz Salera. Yep.
Yes.
I should have checked that before we started recording, but no.
We got it.
We have Yaz in the studio today. Yaz is a registered nurse in Canada and worked in postpartum or
postpartum and labor and delivery.
And labor and delivery. Awesome. And so has a couple of stories to share with us. But I guess like where we would love to start is going into the birth space and in a hospital system. I mean, you would have had a lot of like premeditated notions of what to expect. Did what you saw line up with what you expected?
I feel like nurses, when you start off, especially when it's the first place that you start working as a nurse, and that was the first unit I started working at, like everything you need to learn is so much. There's so many policies and guidelines, and it's all like you have to do this, or if you get sued, you lose your license. So you're just like, even in nursing school, it's like if you don't do this, if you don't document, you get sued. So you're so like focused and fixated on those things that it's almost like it's hard for you to relax, let go of those things, and be able to focus on like, oh, okay, this is what I'm seeing like in birth, and start questioning it. So at first it was just like, okay, this is, I did that. I got my check mark. Okay, this is how it is. But within like the 3 months that I was working labor and delivery, I was just like, wow, like I love watching birth videos and home birth videos, and it's so magical. And it's just this beautiful energy, and you feel it, and you're like, I want to have babies. And then in the hospital, I'm just like, like this looks traumatizing. And these women, like there was one case that I'll never forget. I was still in my training, and this wasn't my patient, but whenever anything starts happening, like, they just call all the nurses that are there to come in. So you had about like 10 people in the room, the respiratory therapist, the pediatrician, DOB, the resident, the 2 nurses, then all the other nurses that came to help. So like it looks like emergency. You have all these people here. And I could see the dad standing there, and I kept looking at him because it almost looked like he was going to faint. Like he was just pale as a ghost. And they were using forceps on the mom. And the OB had blood on her face. And the mom was also just like, she had an epidural, so she wasn't feeling the physical, as much. But you could just see the terror in their faces. And I was also like traumatized just watching what was happening. I'm like, this sucks. Like this whole situation.
Do you remember what the emergency was?
It probably just the baby's heart rate started dropping, and it's like, okay, we need to get this baby out now. So that's when the forceps or the vacuum will come in. But I also remember the pediatrician and the respiratory therapist standing by the warmer, because as soon as the baby comes down in those cases, they take the baby to examine. And they were just talking about what they were going to have for lunch and kind of like giggling, because it's just like, oh yeah, this happens all the time. Like it's just another day. But for these parents, it was just like, no, this is their birth, probably the first birth. Like, I don't remember the details, but it was just like, this is not how birth should be.
Which is like really interesting, isn't it? Because, I mean, we've been looking into rates of stillbirth and so forth because we have been doing quite a few stories on that. You see a lot of these emergencies and all the intervention occur when baby's heart rate goes down. Babies are generally in the birth canal. Like we're talking like it's going to be born in moments. Maybe if it's your first, you're pushing for a little while, but then you can see babies, you can kind of get that feedback. The rates of babies actually passing from being alive and well during the labor process and then like just from that traveling through the vaginal canal into the world is like nothing.
Yeah.
It's nothing.
It's very low. Yeah.
It is so low. So yeah, of course those 2 specialists and whatever specializing situation they were in were just having a chat and a giggle because like the chances of anything actually being wrong with the baby, even with a decreasing heart rate, if the baby is close enough that you can use forceps or a suction, baby's probably like the chances are, I think it's nearly nothing. Like I think it's like that's how low it is. Like usually it's just before baby, like baby's due date, or just after baby's born.
Do you have like memory of how the start of this labor, or like the up until there was intervention, like why there was intervention in the first place?
So because that baby wasn't my patient, like that woman, like I don't know anything, like they just call out for help and then all the nurses come in. So for that one, I don't remember, but what ends up happening like all the time, it was like the 3.5 months that I was there before I went on leave, pretty much standard, like all of my patients, because it's one nurse per patient, induction, everyone, like they're either an induction or they're an augmentation, which means they started to go into labor spontaneously, but they're going to come and we're going to augment it. We're going to speed it up. We're still giving them syntocin. Is that what you guys call it here, right? Synthetic oxytocin. Like it's just the only natural births that I actually saw happening. Either someone comes in, their baby is like coming out of their vagina, so we don't have time to intervene. Baby just comes out. Or midwife patients. So in Toronto, most hospitals, it's just like labor and delivery nurses. And then you have midwives that have rights, privileges in certain hospitals. So if their patient chooses to deliver in the hospital, they will show up and they're allowed to deliver that baby there. So sometimes, like there was one instance where the secondary midwife didn't arrive in time and they were doing an emergency C-section in the back. So I was the only nurse on the floor, and the midwife started calling out like, I need help in here, baby's coming. So I went in, and that was like, oh, like spontaneous, natural, no epidural. Baby came out, and then within 2 hours I went to say bye to them, and I was like, you're standing and you have your street clothes on, like, and you're going home, like what? Because none of my patients, like they all get epidurals. Like with the contractions from oxytocin, it's so intense that most women cannot tolerate it, right? So most women get the epidural. So for 2 hours, they're still in bed in their gown, and then they get up slowly, they go pee, but they're still in their gown, and then they get transferred to postpartum, and they're there overnight. So different. Like, oh, like you're going home after 2 hours? Like, you look amazing. You're just walking, like night and day difference, you know?
Oh my gosh.
So when you started seeing that, because I'm guessing that you kind of indoctrinated into this situation where I don't know how much you knew about birth beforehand, but being a registered nurse and then going into like birth in a hospital, maybe I should ask, is it like does it feel like an indoctrination? Like you're like, oh, okay, this is what normal birth looks like?
I think I'm a little bit different from a lot of the nurses that go into this area, because I think I was already super interested in birth beforehand. Like I contemplated becoming a midwife. So I had already done a lot of like research and watching of natural birth. So I knew that like, okay, no, we can do this. Our bodies are made for this. So when I went in, it just like from the very beginning, it didn't sit well with me. A lot of us like, but why? Why are we doing this? And why aren't we supporting women to like, oh, okay, you know, if you do want an epidural, that's fine, but let's try everything we can beforehand to support you. Let's keep walking. Like, let me give you a massage. And that just wasn't the standard. Like nurses would just be like, okay, do you want the epidural now? Okay, well, the anesthesiologist might not be available. If you don't get it now, are you sure? Just like lie down, let me put the strips on you. And I work with amazing nurses. They're like really sweet people. But when you get into this area, you're taught like, this is how it works. This is what you do. It just kind of becomes what you do. Mm-hmm. And they're like lovely people. Like no one's there trying to like,
let's sabotage.
Yeah, like let's sabotage. We don't give a shit.
Her
yeah, like whenever there would be code pings, whenever babies would die or if we're working on them, like these nurses would walk out like bawling, you know, and they would like go home, and for weeks we'd be talking about cases, and like it affects them. And I think a lot of nurses and even OBs, like I can think of one that I'm just like, oh, I don't want to work with him. Like, why is he like that? What a person. But then like he just had like back-to-back horrible cases where these babies were dying. And not even his fault. Like the baby would be coming out like a 24-weeker, like a twins already, like legs half out, and then they were working on the baby. But then the babies die and the parents are crying. And over time, if you're doing that for 10, 20 years, like there's only so much that you can give every day emotionally.
Yeah.
So they do become cold. And me as a new nurse coming in there, it's like, why are you so rude? Like, why don't you have any sympathy? Like this one stillbirth case I had with the same OB, he went in, delivered the baby, and just left and didn't even say anything to the parents. And I'm like that's so heartless. Like, and it's just like, I think he's just like, I can't deal with it anymore.
Can't feel it anymore.
Like, I just need to, like, you could see in his face that like he was upset, but he just like didn't have anything left to give in that area.
I feel like we've spoken about it before on the podcast, but it's kind of the same situation as like for surgeons. Well, not exactly the same, because I guess going into obstetrics, you assume to be, bringing new life into the world, and it's a really happy moment, and it's like the best moment of the parents' lives, and you get to like feed off all that beautiful oxytocin. Not so much the situation when the baby has passed, but like for surgeons to be able to do what they do every day, which is like slice people open and then stick them back together in like ways that just, I mean, I've been on so many surgeries where I'm just like, holy, like really, no wonder that person's in so much pain afterwards, and I'm talking like knee replacements where they've got like hammers and like smashing into a femur or something, and you're just like, but you have to be like a sociopath to some extent and like completely cut off your emotion to be able to function and do that over and over again. And I would imagine the same for an obstetrician. And you would get to the point, like it's almost like we're creating these monsters by not changing the system. But no, I do sympathize. It's actually quite sad, isn't it?
It's like the happiest unit and the saddest. Like it's usually happy, mostly it's happy. Even when it's a tough labor and delivery, it's happy at the end. Yeah. But then when it's sad, it's very sad. And I think it does harden people over time.
Yeah.
And the system, it doesn't help. Like I think people come in, you're scared as a new nurse and you're scared as a new doctor too. And basically the way things have been, people are teaching like, this is how we do this. And you're just so focused, okay, like I can't make a mistake. Like someone can die, or if they do die or if anything goes wrong, they're going to look through my records and they're going to see if I did it properly, and I'm going to get in trouble if it's not done properly. So I remember like, because I was early on as a nurse in labor and delivery, and I just did not want to leave my patients ever. Like I just wanted to be in there with them. So sometimes I'd be in there 6 hours straight, like standing, massaging them. And then I would go out for a second. Another nurse would be like, what's going on? Why are you still in there? And I'm like, well, she needs me. Like, she doesn't want an epidural. Like we're trying and stuff. But you just start to, like, I guess you start, like, if you do that every day, like you're there for 12 hours a day and you're not taking your breaks, like you're going to start affecting your own physical like health. If you're not peeing, if you're not drinking water, like how long can you maintain that? So the system is not set up for nurses to be able to support women properly, even when they want to. So over time you start to be like, oh, I know she needs me, but I need to sit down. Like I can't be in there, like, because you're there for 4 or 5 days. Sometimes you're picking up extra shifts and you're going home, you're sleeping, you're getting up, you're eating, you're coming back. And it's just like, it's a lot. It's not set up to support women properly.
I actually, I feel like I should let you talk.
Go.
I'm going to get in trouble from our 3 listeners who tell me I talk too much. But I feel like that does feed into, like, I mean, we have had people on the podcast before where we've spoken about the convenience around giving an epidural or giving augmenting a labor or whatever that is, because there is a part of the factoring in to that is like, okay, where am I at as the support person? How much more capacity do I have to physically support this woman? And I know I've got other clients I have to attend right now. Like I know those wards can get extremely busy, especially on a full moon. So I can see, I can see that would get factored in. And I think that's actually one of the scary things that women are trying to avoid, because you don't, when you think about you going into a hospital to labour, and I guess this is more women in our network rather than the world at large. But when you're going into those labour wards, you don't know what you're getting. You don't know if the nurse that's going to be helping you has just come home from a massive sleep and a great meal, and her family's really supportive of her. And, you could get someone who has been run off their feet for 15 years and they actually hate what they do now, and they've experienced way too much things going wrong and women crying and traumatized, and they're like, what would really help you? What would really help me is if you just get an epidural. Don't have to deal with your pain. And I don't have to deal with you complaining, or I don't have to deal with, the potential that this is going to drag out for 12 days. So it's
But logistically speaking, and being pragmatic about it, we have sat here for days complaining about this system, right? But what's the alternative, right? Because what would actually help is if everyone just laboured at home. It's really simple. And then the women who actually just couldn't just go to hospital and use the system.
Yeah.
And then they're not so overrun, and we're no longer normalising all of this intervention, and it's no longer normal to be, cut open, and it's not normal to be, basically numbed out.
Yeah.
Because it's inconveniencing the system. Because it does, essentially, if I have to look at the other side, it's if women rock up and they're a couple centimetres dilated, or at the very beginning, and
they're struggling already.
Yeah, they're struggling already, and they have to fit into that. We're not helping each other, and we're not really, it's not great it's not helpful to be oh, fuck the system. It's well, okay, look, what are we going to do? Because something has to give, and it's the system's at capacity, and it's rolling like that, and it's not going to stop rolling like that, and it is what it is.
And there's the element of money making too.
Yeah,
they need it to have it at capacity, but with limited staff, because you don't, for every staff, you still that person has to get paid, but it's not going to equal more people coming in the doors, it's
technically still a business.
Yeah.
But yeah, I just I do reflect, or just think about what's the women actually are going to have to think about, okay, this is happening almost 90-something% of the time in Toronto. And I remember living there, and people were fucking amazed that I had a baby come out my vagina with no drugs. I'm yeah. And then again and again and again and again. And obviously it's not normal.
So many again.
And so, but at the same time, I actually, I have a beautiful friend there who is a midwife, and she was incredibly supportive of home birth. And, so I think it is there as well. It's just a matter of women understanding what are the probability of walking into these doors and having to endure XYZ, or even they don't even know that XYZ is a possibility. Because I think the other thing is when you are pregnant, it's all just we're going to aim for this. Our aim is to get you a healthy baby that's,
the end goal.
The end goal is, we're just going to do it. We're going to get it done. It's going to be great. It's not really 90% of the time, this is how it's going to end. So what are you going to do to get out of that?
Yeah. I think it comes down to that. Women just aren't fully aware of what other options are and what the risks truly are for things. It's so normal to just be oh yeah, I'm getting induced this day. Oh yeah, I went a day past my due date, so my doctor suggested that. It's oh, did he tell you the risks? No, what? It just seems oh, there's an easy way. I can just go there. Or even if it's a selective scheduled C-section, which sometimes you have first-time moms doing it, but it's mostly repeat C-sections that they'll just be oh, no, I don't want to try vaginally, I'm just going to do it again. And I can schedule, I can choose the date. There's the convenience there. But with first time moms, it's become the standard. Just like most people get OBs. Like in Toronto, I think there's only like 3. I know there's one like higher, like up north, but 3 groups of midwives, and they're often full. Like if you don't get a midwife as soon as you're pregnant, chances are like you just can't get a midwife. And the only way you can have a medical provider attending you at home is if it's a midwife, right? Like OBs won't go or family doctors won't go. So because it's not common, like unless you've had a friend that has done it, unless it's come onto your Instagram, like you're just like, oh no, you go to the hospital. That's what everybody does. You get an OB because that's what everybody does. And, chances are you're going to be induced. And women don't realize that when you are induced, you have like a 20% chance of ending up with a C-section versus I think it's like 12% if you go into spontaneous labor and go to the hospital. And if you have a planned home birth with a midwife, that goes down even more. And if it's your second, that goes down even more. So like your chances of having a vaginal delivery, it's like 97% for your second one with a midwife at home. And women don't realize this, that like the moment they step foot into the hospital, because like they're scared, it's your first baby, you don't know what to expect. Like, is this too much pain? Is this normal? So a lot of women will show up and they're just like 1 or 2 centimeters. And sometimes like we'll have to turn them away and say, keep walking and then come back. Like we don't have space for you right now. But if we do, we take them in and we augment. We give them Pitocin, get things started. And to get an epidural, we need to do the EFM, the external fetal monitoring. And we need like a 20-minute strip. So that has to, and you're lying down for that. Like sometimes we'll have wireless. Some hospitals don't even have that option. And it's not very good. If you're moving, it keeps sliding. Like, so it's just like, can you just lie down and don't move? So we get that strip and then they get the epidural, and then we got to check to make sure baby's heart tolerated the epidural fine. And then if you are on oxytocin, then we got to keep monitoring. So they don't understand that like the moment you step into the hospital, you're going to get this cascade of interventions, and the epidural can affect your baby's heart. And the longer you're in labor, the longer the baby's getting that, and it's going through the placenta, the baby's getting that drug or the oxytocin, the contraction. Like every time you have a contraction, your uterus is squeezing and the baby's not getting the same blood flow, and oxygen is carried through the blood. So every time you have a contraction, it's almost like the baby's having to hold its breath. So with the oxytocin contractions, that's why you have to be on the monitor, because we have to check, are you having too many contractions? Like we want to make sure that you're not getting more than like 5 and that the baby's heart's tolerating that. So you're basically just going to be lying there, strapped to the bed, not feeling what's going on. And I feel like that affects the psychological piece a lot, especially for first-time moms, when it's like your body's doing it, but you're not feeling it. You're not getting those natural endorphins. You're not going to get that same surge of oxytocin that you would have naturally when your baby comes out. So there's a bit of a disconnect, I believe, when women don't get to fully experience labor naturally. Like for myself, I was in labor for 24 hours at home before I ended up going to the hospital. My baby was breached. I ended up getting an epidural and having a C-section, even though I bawled my eyes out and I really wanted them to do a vaginal. And I knew I had never seen that done before, but I'm like, I'm going to ask. Maybe people just don't ask. And the OB laughed. She's like, no. Like, what? No. She's like, last breech delivery I did was 22 years ago. Like, they don't train us for this anymore. Hospital policy. Like, we can't do this. And I just felt so robbed. Just like, I'm here where, you tell me it's the safest place to deliver a breech. But why can't it freaking be vaginal? Like, why? Like, this should be my choice. Like, everything has risk. And like now my baby's 7 months and I feel so much pain still on my belly from the C-section. And like, that's a risk, the scarring, like for future babies. And it's just like, oh no, C-section's fine. Like they act like C-section, no biggie. Like I've seen it. They cut through 7 layers. It's a biggie. Like, and women should be able to choose and they should be aware of all the risks, and women just aren't. And I think if they were, they would be choosing to labor at home longer, and they would show up like those women that I were talking about. They're like, baby's coming out,
falling out.
you know,
Yeah.
or they would be like, oh, baby's falling out. Why am I going to go to the hospital? Like, midwife, come here,
Yeah.
you know. But
I think it's really interesting, actually, what you just said. Reminded me that Sarah J. Buckley, who I don't know if you've heard of her, but she's an obstetrician here. I think we poached her from New Zealand, actually. She's a mother of 4 and home birthed all of her own children. And she she was doing her PhD, I think, in looking at the hormonal effects of a epidural. And I mean, we've had Rhea Dempsey on the podcast a few times, and she talks about how thrilled she is about
epidural. She called it.
epidurals. But yeah, looking at the cascade event, of hormones and how that plays a role, well into postpartum as well. And I'm really sorry that you experienced that. I don't know if you've listened to our episode with Dr. Stu.
Yep.
But he is fantastic and is going around the world teaching everyone how to vaginally deliver or help women to vaginally have their breech and twin babies at home. And I get all of his stuff all the time. So it breaks my heart that my Instagram feed is just feet first babies into the world. And you've seen an obstetrician that's like, I don't even know what that is. She shouldn't you be up to date with the latest? Come on, guys.
Well, I don't think if they were up to date with, evidence-based practice, or it was up to date evidence-based practice, that it would be very conducive to, I just don't see how it would work. How are they going to have, how would they have hundreds of women naturally birthing in a hospital? It just doesn't make any sense to me. How?
Yeah.
Unless they're coming in when the baby's about to fall out, but that wouldn't work because we've all been, or we all know someone who got to the hospital in active labor and everything just stopped. There's a whole,
or they birthed in the car park before they walked in the doors.
I think we have to be realistic as well about if we are planning to go to the hospital, or we want a natural birth, or the expectation is to be natural, is just we can't all go to the hospital and have a natural birth because there's no capacity for that. There's no time for that. I don't think anyway. There's a whole procedures and policies list and whatever that goes on, and really understaffed, overworked midwives, nurses, and people who are really desensitized, grumpy, and I don't know.
I think that women also and this doesn't pertain to you, but how many women actually really want a natural birth? This is obviously not in the people who listen to our podcast either, because we know you girls want your babies out. But in when you're talking about women who kind of just hand over their power to the system, it's okay, how many actually want a natural birth? Because my first baby was, and I'm sure everyone knows this, but I'll say it again for fun, was with a private obstetrician in the hospital. I think it has the highest C-section rate in all of Australia. And I walked in there and I was because I said to my obstetrician, I want this to go down as naturally as possible. I'm terrified of needles. I'm terrified of surgery. I'm terrified of feeling numb at all. I'll do all of those things if I have to, but I would really prefer not to. And because I said that, I didn't have one person, hopefully because I said that, and I do feel that a lot of luck came into my situation, but I didn't have one person offer me any pain relief. And I got to hold my baby as she was emerging into the world naturally, without being cut open, without there was just so many things that happened the natural way, because I had spoken to my obs and was I'm terrified of all this other, anything else that could happen. I would prefer to just be in whatever pain I need to be in. Mind you, when I was in labor and I was on that table and I couldn't speak anymore, I was praying someone would cut her out of me. But how many women actually vocalize to their providers? No. I want a natural birth, and whether that's for reasons like me, because you're just terrified of any other way it could go down, or if it's I've done my research and this is like 100% what I want. I guess those people end up just having home births or free births. So
Well,
hey.
yeah, that's the thing.
Mm.
Like, I would see women show up for their induction, and like they're already scared. Like they show up and be like, okay, well, here's your gown. Put this on. I'll come back. And then I come back and you're lying on the bed, just like they look scared. They're just like, okay, what next?
Mm.
You know, they literally like hand over their power, and then they lie there and they're like, hey, tell me what to do. And they don't, like, most don't ask questions. They don't ask, what are you hanging? Like, unless you're telling them, they're just, yep, you do it. Like, they're just, it's almost like they just completely tune out and just like let things be done to me. It's like they're not an active participant in their birth. Like, it's supposed to be you. It's supposed to be about you and your baby, and you're supposed to really be an active participant in that. And they just hand it off. And something that I kept hearing a lot in a lot of podcasts that I was listening to, free birth stories, that like, if you get a medical midwife, like they're going to sabotage your birth. Like, you can say these things beforehand, but when the time comes, they're not going to listen to you. So my husband and I talked, and he was like, I would really like you to have a midwife. And I was like, okay, let's do it, because it's almost like an experiment. Like, let's see what I can take, what I can deny or decline. So my experience was actually really positive, because I don't know if it's because I'm a nurse and she respected that, but I would come in and she'd be like, okay, well, next week we're doing this test. And I'm like, oh, actually, I'm not. Like, these are my reasons, or sometimes I would just be like, I'm not. That's it. And she'd be like, oh, okay. She's like, well, I have to tell you anyways, like, you know, that it increases the risk of this, and that. And I'm like, yeah, cool. And she's like, all right. And then there was 2 midwives that I was seeing, and one of them's like, okay, yeah, you're a smart mama. Like, I'm just going to put you declined. Like, they weren't insisting. But I was telling my husband, I'm like, I'm really scared when I call them that when they show up, they're going to be like, well, can we just check? Because I told them, like, I just want you in the living room. Like, go eat pizza. Like, don't talk. Like, don't I don't want you to talk to me. I don't want you to just pretend you're not there. And I will call you if I feel like I need you. So I had a lot of really thick meconium, and I've never seen it like that. Like, in the hospital, I've seen stained amniotic fluid where it's like a little bit green. This was like so much crap. Like, I was like, oh my God. Like, it just kept coming out really thick. I was like, I've never seen that. And then I know that thick, it significantly increases the risk of the baby aspirating that. And because it's so thick, it could be really bad. I didn't know she was breech, you know? So I was like, okay, no, I want them here. Because at one point I was like, if everything's going well, I'm just going to call them once the baby is here.
Yeah.
But once I saw that and my waters had been ruptured for 24 hours, I was like, no, I want them here just in case. And they came and they didn't say anything. They're like, how are you feeling? And they just sat back. And then I'm the one that said, I want to be checked. I want to know how far along I am at this point. Because I'm like, I must be close. And then when the first one checked, I was only like 1.5 centimeters after 12 hours. And I was like, what? No, this can't be. So I got out of the tub and it kept moving. And then like I threw up, everything picked up. It was so intense. And then 4 hours later, the next midwife came. And I'm like, okay, I want to be checked. Like, I must be close. I'm starting to feel a bit of pressure. And she was like, 4 centimeters. And I was like, no, like what? And she was like, and I don't think it's she's like, maybe it's the face. Like, I can't tell what I'm feeling. So she was like, I advise we go to the hospital, quick scan just to see what position baby's in, and then we can come back home. She knew I really wanted a home birth. That was the only time she suggested that, because midwives are not supposed to be delivering breech. So, you know, that is a normal suggestion for her, but she was very like, we can come back home. Like, we just verify the position, but they never said, can I check? Can I listen to the heart? They didn't do any of that. So I feel like I got what I wanted, and what I didn't want, like, it was not pushed on me. And since I ended up in that C-section, when my baby was born, the pediatrician, who I still have issues with and still thinking about how I'm going to deal with this. And like, I think I need to go talk to her, because I feel like she treated me in a way that like, oh, your GBS unknown. You were home for 24 hours with your waters open. You had thick meconium. You didn't do a 3rd trimester ultrasound. You didn't know your baby was breech. You are so reckless. And she came just before we went out for the C-section. She said, the baby comes out and she's not crying. I'm taking her to the resuscitation room. And I was like, can you just give her a second? Because I wanted to do prolonged cord clamping. And I knew with the C-section that was going to be a minute, but at least a minute. And she was like, no, if the baby doesn't come out crying, I'm taking her. And no sympathy. And I was crying. I was so upset. And as soon as she came out, and it's super quick, the C-section, like baby's out within like
I think it's
minutes.
15 minutes.
Oh no,
max.
less than that.
Okay.
Like sometimes like within 5 minutes. Like they do 2 or 3 cuts and baby's out.
Mm-hmm.
What takes long is the stitching. So baby was out super quick, and I heard time of birth, and I told my husband, I'm like, she's here. And he's like, what? Already? I'm like, she's here. And then I hear them saying, baby, come on. And I'm like, and then I hear them saying, cut, clamp, cut. And I was like, no. But then as they're saying that, she goes like, I'm like, no, like, just wait. Like, she's coming too. Just wait. And as the pediatrician was walking out of the OR, she was screaming already. And I was bawling. I was so angry because she's like, why the fuck? Sorry, I can swear, right?
Yeah.
Like, why the fuck are you taking my baby away when we actually have a resuscitation table right beside me in the OR? Like, there was no reason for her to take the baby who actually didn't need resuscitation to the NICU resuscitation room, which is across the hallway. When, first of all, she's crying vigorously. She does not need resuscitation. She's crying. She's breathing. And even if she needed some suctioning or anything, could have all been done there. They took her for 9 minutes. They did deep suctioning, and they're telling my husband, take photos. And he was telling me, like, why? Like, and so he took a few photos, but like she's screaming and like she's hating that they're jabbing this all the way, like deep suctioning. Oh my God. And that's not even part of the resuscitation policy. Like, even if the baby is not vigorous, like suctioning is not one of the first things you do. Like, if at some point you realize that's necessary, you can do that. It wasn't necessary. She was screaming vigorously. Like, sure, she might have been a little grunty after, and she would have had a lot coming out because with vaginal, you have that squish that pushes the liquid out, but not with the C-section. So maybe she would have needed a little bit of suctioning after. But like, there was no reason that she had to be taken away, and it had to be done that way. But I feel like she did those things because she was not happy with my choices. And that's so infuriating to me. And I just see that in hospitals, like women come, and if they did do their research, if they speak up, then it's just like, oh, you're going against the grain. You're reckless. When it's like, no, these women are the ones that have actually done research. The other ones don't ask anything. They don't know anything. They never even read anything. They're just like, yeah, do whatever you have to. Yeah.
That's something that we've actually seen a lot. Can we take this in a slightly different direction? Because this is actually something that we've discussed, and we've wanted someone to come on. And I guess we're still looking for that person on like how to navigate the medical system, because the choices that we and most of our listeners would make, which is perhaps your child isn't vaccinated, perhaps you don't use paracetamol at home, perhaps you will cure a cold or support your child's immune system rather than stuff them with like antibiotics and de-stuff medication and all of these other things. And how if you do need to go to the hospital, that is viewed as negligence.
Yeah.
It's viewed as negligence. And I could almost see the exact opposite being true.
Yeah.
Like hospital staff are negligent if they do not realize that you can actually do a lot more with all of these ailments than pump it full of drugs. But when the hospital is necessary, which we've both been in situations, and so have you, where the hospital is actually necessary, it's fucking terrifying as a parent who has made these decisions based on science and health and lifestyle choices and experience as well. When we're going to go in with our sick child, we're vulnerable because we're like, okay, now we're at a stage where my knowledge base is down and maybe medications are necessary. Maybe not all the ones you're suggesting, but medications nonetheless, or stitches. I recently had that with my son. So it's really hard to go in and then like have this judgment and have them make decisions based on how you've raised your children so far, because they disagree with your birth choices, and I've had that prejudice against me when I was in with my 14-month-old and she was asking about the birth, and I was like, weird, but this is, he was born at home. It was a very quick birth. We didn't get to the hospital. Anyway, few other ticked boxes, and she had me down for negligence straight away. And I'm like, I would have thought you'd really like that I didn't want him to eat some dirty dairy filled but not with real dairy 745 ingredient custard that you're offering me for my asthmatic child. Like surely there's some kind of coherence there, but like, yeah, it's really interesting. And not interesting, it's actually really fucking heartbreaking when that happens, because it actually is isolating the people who, you know, if you're a medical provider and you're listening to this, if you're making decisions based on someone's like health lifestyle situation and not on the actual problems that are presented, it's going to ensure that those people who do need medical assistance do not come.
Yeah. And that's happening a lot. Like even, I think we've been talking about this a little bit too, like in our community, like up north a little bit, there's been a couple of cases lately where the mum has taken their kid to the hospital and for very minor reasons have been threatened with child protection services.
Yeah.
And that is wild to me. Like there's no way that mum's taking her kid back to hospital with any problem, and even severe. And I think that's the problem. Like there's a lot of nurses and doctors really complying with these outrageous things, and I feel like there's a lot of people who, or doctors and nurses, who are like, it's not really like, doesn't really sit well. I don't think that's necessary, but are doing it, and it's making it okay. You know, and same thing with that situation where they've made spinal taps norm. So like if you present a sick child, even just with a couple of symptoms, nothing major, straight up want a spinal tap, and if you decline that, you're
negligent.
Yeah, and from what I've heard on a lot of podcast stories, where it's even more likely, it seems, if you're someone that birthed at home, if you're someone that didn't get the antibiotics, that didn't do the GPS screening, it's like, oh, for sure, you have meningitis. Like,
yes,
you know, and like, there's so much I want to say about what you're saying. I'm trying to make this straightforward.
It's okay. Use 740 words to describe like one little thing. I do it all the time. Yeah.
No, I always heard you talking about like how you lose your vocabulary postpartum. Like bizarre. Like I'm still trying to get my words back. But one of the things, like going on the other side of it, if someone shows up and they're obese and they're smoking, we're not supposed to judge their lifestyle choices, you know? So like, oh, they're very unhealthy, but those are their choices. We should not treat them any differently because they chose that. But then on the other spectrum, you have people that are trying to be really healthy and really owning up their health and doing things that, you know, like, this is what aligns with me. This is what I think is best for me and my family. And I'm really doing my research and I'm really trying here.
But it's evidence-based too. Like I make the decisions for my children
based on PubMed research.
I literally check out of a lot of the boxes based on evidence-based science.
Totally. Exactly. It's not like I had a feeling.
It's not from a like Facebook, Instagram health guru. It's like really rooted in something reasonable and responsible.
Yeah. That's for you to see how like backwards and not up to date they are with things. And the point of like women not wanting to bring their kids in. It's the same thing about women not wanting to come to birth in the hospital. Like I had a friend who tried to free birth. She was in labor for 3 days. She actually got to 10 centimeters, but she had no energy left and she wanted to transfer. So she ended up going, and like I called the hospital because it was the hospital that I was working out before I went on leave. And I was like, hey, this woman's coming. You know, she's my friend. Like, just kind of like, please, like, don't judge her. Like, please be nice to her. Because like, I know how it is. They'd be like, oh my God, look, did you see this woman coming in? No prenatal. Like she actually had a naturopath and did blood work and stuff. But like some women do nothing. She had no ultrasounds. So it's just like, oh my God, so reckless. And it are like very nice nurses, but they're not used to that. So, and then like that pediatrician, I was familiar with everyone else. I delivered in the same hospital that I was working at. And this pediatrician, like I had seen her before, but wasn't familiar with her. And she judged me, and she probably knew that I was a nurse there. And imagine if I wasn't. Imagine if I was like, oh, look at this hippie here coming, you know, just like, that's not okay. And like part of me, I'm like, I can't go back.
Yeah. Can you imagine like using the example, the contrast before, like, oh my God, look at this fatty coming up the hallway.
Exactly.
Oh my God, look at this obese person with skin lesions because they haven't been outside for, how do they even fit? Like, can you imagine that?
Right?
Like, they would be fired.
Yeah.
Straight up.
Totally.
Fired.
Like, it's not okay to judge in those areas, but in this area.
Yeah, like taking my example of being in hospital with my child who was having his first asthma attack ever. Like only moments after we arrived, there was a kid who was morbidly obese come in at 4:00 in the morning with a Happy Meal and a Coke because he had a cough. I'm pretty sure he probably had something much more sinister, but like that parent's doing the best.
Yeah.
They can.
Mm-hmm. Yeah. What the
Double-
fuck?
Double standard.
It's messed up, and I feel like you were saying, like it's evidence based. These women are researching, but it's like the hospital society, like medical society. They're just like, oh no, we're not. They just got that on Instagram.
It's
these
misinformation.
stay-at-home wives that are just learning all of this on Instagram. That's what they believe.
Trad wives, mate. Trad wives. But like, I think it's like a hierarchy in their mind, right? We are the best. Like, this is the best care that someone can have, and if you're not coming to us for the best care someone can have, then you're seeking less than the best. So you're negligent. Yeah,
like why don't you care about your kid? And it's like you only know what you know. So I remember when I was telling one of the nurses there that I was going to have a home birth. She'd been there for like 20 years. She was like, no, sweetie, no. Like, why would you do that? She's like, if something happens, I'm going to beat you. Like, why would you do that? You're not having a home birth. And I was like, yes, like the evidence actually shows that it's safer, like, or just as safe. And I have a way less chance of ending up in a C-section or having an episiotomy or a surgical birth. And it could be magical. Like, why wouldn't I want that? And she's like, because when you're working in a place where like 30% of women are being induced, 20% of those are ending up in C-sections, and you're having emergency C-sections all the time, which like Dr. Stu says, emergency.
Not an emergency.
Like sometimes, yes, running down the hallway, like let's get them in ASAP, but not all the time. But it's like, strip's not looking good. They're going to be C-sectioned. Or they'll be saying that to the woman, like, it's not looking good. Nah, you're probably going to end up in a C-section. Like I've seen nurses say this, and I'm like, don't say that. Don't plant that in their head. Like now you've already like doomed them. Like you've made them anxious and not like, and yeah, just like that. And I've had patients where I'll come in and they'll be like, where were you? Like their strip is a mess when I come back, and they're just so anxious. Like, well, the nurse said my baby's not going to fit and I'm going to probably end up in a C-section. I'm like, what the fuck? Like, why would you say that? Like, no, like, and it completely changes the trajectory. Like this woman now is anxious. Her heart rate's up, baby's heart rate's up. And yeah, she ends up in a C-section. And it was beautiful before I went on break because I was like, no, you're doing great. It's okay. Like you got this. No, your baby's coming. Like your body was made for this. And the language changes everything. But where was I going with this?
Welcome.
It was important.
Welcome to motherhood.
God.
What we're seeing at the moment is this awful movement of like professionals pushing people who are already hesitant about the medical system further and further away.
Yes.
And actually, I have like a bit of a little anecdote here because I had to go to emergency with my son who split his hand open. It was a very deep cut. And I looked at it and I was like, oh, it doesn't look good. But we got there and I'm like, look, we didn't see how it happened. He was playing at the beach and like fell over on a rock. He reckons there was like a big shard of, I don't even think I've told you the story, like a big shard of like ceramic, like something ceramic broken, and he landed on it. And it was late. Like I had a little look inside. I'm like, oh, you've gone through some tissue there, my son. Anyway, we got to the hospital and I was like, is it like the doctor looked at it straight away and was like, yeah, that's going to need stitches. And I'm like, is there any chance that it might not? You know, like, now, like to do the stitches, we have to give him fentanyl and nitro and local anesthetic, and we're going to have to x-ray it as well, and he's going to need Panadol and Nurofen. And I was just like, sorry, what? Like, it's stitches. I'm like, can we actually just try the local without, like, like he's handling the pain right now without anything else. Like, can we try the local? He freaked out in the needles, so we had to give him some nitro, but I got away without fentanyl.
Nice.
Fentanyl for a little baby. I was like,
Well, fentanyl is in a lot of epidurals, which is crossing the placenta and going to
the
the baby.
Oh yeah,
And
and they're not screaming and super freaking lively.
Like when I
they
got
come
mine,
out.
the baby's heart rate had been beautiful the whole time. And as soon as I got the epidural, it went down to 60. And my midwife started freaking out. And I'm like, yeah, okay. Like I'm already turning my body back side to side because like that's one of the things you do to get the blood flowing.
Yeah,
And she was like, I need help in here. But no one came in. I don't know why. But
Because you were negligent.
I think
So-
so.
you wanted a home birth.
I was remember I was like, why
No
no one
one
come
deserve the
in?
care. You don't
They
deserve
know
the
me.
care.
No one came in. I thought that was kind of weird. But then it came back up.
But then they were so concerned once the baby was born that they took her away from
Yes.
you direct, like
Mm.
straight away.
Yeah. Even though she was crying.
Mm. We'll process that
Yeah.
a little bit later.
Like
But
still
yeah,
makes me angry.
I like one of the things that I actually saw that I'm actually going to do a course on sutures because I'm never going back to the hospital to get any of my children sutured. But what I did see is like, okay, one, there was a lot of stuff they wanted to do for practice. Like I'm like, he doesn't need an X-ray. He hasn't broken his hand. Like
Yeah.
I'm making him do all
Yeah.
the he hasn't broken his hand. They're like, oh yeah, but if there's shards of stuff in there, I'm like, look at it. And it's bled profusely. I'm like, have a look, like let's give it a clean.
Yeah.
Have a look. And they're like, oh no. But I'm like, okay, they want practice. I need to say, I know when I go into hospital, I need to say yes to at least 3 things to make sure that I don't get pigeonholed. So I'm like, okay, we'll do an X-ray. Yes to the local, obviously, if you're going to be stitching them up. I'm like, nitro only if it's necessary. So they ended up giving him nitro. They start doing internal stitches. And then they're like, oh, wait, I think we missed some dirt. Cut open the internal stitches, wrenched it open, scraped it out. Oh, no, it's just a blood clot.
Oh.
Sewed him back up. And because he couldn't feel it, because obviously he had the local, and they
Mm-hmm.
put the local like directly into the cut as well as all around. Yeah, it's pretty gnarly. But I was just like, and this is what I feel like is the same with an epidural and then using forceps or like coming and manually extracting a placenta, or even with a C-section, like just because she doesn't feel it now, just because my son doesn't feel what you're doing now, it doesn't mean that at 12 p.m. tonight when he's asleep, that pain isn't going to come and rear its ugly head, you know? Like it's this thing of, oh, now we can do whatever we want and maybe a little extra for kicks because we've used anesthetic. It's like rather than only doing what's absolutely necessary, because that's a person and guess what? They're going to feel that later. Like that the pain that they're not experiencing now is probably going to be intensified 100-fold later when they can feel again. So I like just even little things like that. Like, can you just consider the human body as a human body, like with pain receptors and all, before we go in and we start just, look.
It's kind of like treating the whole person. Like we're not just treating the cut. We're not just treating, like the baby, or we're not just treating. It's
the problem of
birth.
birth.
Whole like first do no harm. I think we should go back there.
Yeah.
Could we bring it?
Well, and that's the thing,
What are
right?
the laws, right?
Strip it back.
It's just that moment. Like, oh, you're alive, your baby's alive.
That's all that matters.
Bye. And it's like, I was in postpartum for 2 years, so I wasn't seeing how the birth was. But these women were coming, and oftentimes they're sharing a room, a curtain. Sometimes there's like 4. And I was just like, oh, like that was one of the things I'm like, oh, I don't want to like have a baby in the hospital. And then instead of cozying up in my bed, I'm like in these uncomfortable hospital beds with other people. And when you finally get your baby down, the other baby starts crying, or the nurse. That's the thing. Like, I don't know if you guys have seen it on Instagram, like these jokes, but it's actually like that. Like in hospitals, the nurse just comes in every like 30 minutes and like opens the curtain like, hey, did you get any rest? And you're like, no. No, because like the baby was awake and now the baby just fell asleep. And I'm like, oh, I'm sorry. I know your baby's asleep, but I have to do a check. I'm so sorry. I have to unwrap your baby. And I would feel horrible. Or it's like, I have to press on your belly. Oh, that hurts. Yeah, I gotta get in there, see if there's any blood clots. And like, it's just like the whole thing. It's just like, no one cares about how this is affecting you and how you're gonna go home and how your postpartum is gonna be. And that goes back to when we were talking about like the pediatrician and a respiratory therapist just laughing. And it's just like, just another day. And they're doing all these things. You're saying like, oh, maybe the heart rate is just dropping because the baby's right there. The head's being compressed. But if anything were to happen, if that baby were to die, it's all about the lawsuits. Like what did you do to prevent this? Oh, you waited. You thought it could be fine. And like you said, it probably would have been fine. But in that like 1% chance where it's not fine, then the hospital is probably going to get sued. So it's just like, we're just going to do everything to prevent a lawsuit. So like you're on the monitor because if anything happened, oh, what did the strip say? Even though the EFM has a huge false positive rate and it has not decreased the levels of cerebral palsy at all, it's only increased the rate of C-sections. It's gone from like, I think in 2013 was around like 19% and now it's like 29% in Toronto or in Canada. So it's just, and here it's the same thing. It's just going up everywhere. But it's like, well, at least we have something to show for it if it goes to court. And that's what it's all about all the time. Like, well, you need to make sure that you're doing your check in the room because you're also supposed to be palpating the belly as they're having a contraction. And if it does go to court, they can see which computer you were analyzing it from. And was it the computer in the room or was it the computer at the nurse's station? So it all comes down to lawsuits and the fear that they instill in nurses and OBs from school that like, if you don't do this or if this happens, you will lose your license. You're going to, I don't know. Some people might go to jail, but so like, you're so scared that like, I love you and I want to do what's best for you, but I don't want to like get sued and then get in trouble. And so I think it's a lot of it just comes down to that. Like you have to ignore the human aspect that like, no, you look like it's fine. Let's just wait it out. Yeah. It's just messed up system.
I'd love, because you did mention briefly that you had experienced a stillbirth in hospital, since this happens to be a theme running on our podcast this year. I'd love to know what that process looks like and how the women and babies are cared for afterwards.
Yeah. So I had one, which is very dear to my heart because it was the one I had before I went on leave. It was a little boy. He was 25 weeks. And what's unfortunate about the way miscarriages and stillbirths happen, I think in most hospitals, like hospitals just don't have a facility or like a unit that's exclusively dedicated to stillbirths and miscarriages. So unfortunately, these women are delivering their babies where other women are delivering their live babies. So across the hallway, you're hearing a baby cry as you're having your dead baby handed to you. So it's just like, I can't even imagine what that is like. Like I had a missed miscarriage, found out at 20 weeks, but it had passed at 12 weeks. But I was like right away, like, no, I'm doing this at home. Like why would I ever? And then going back to work, I took, I think, a week or two off. It was so hard going back to work because I'm working with babies and it's just like, congratulations, and then my like coworkers be coming to me. I'm like, are you okay? It's like, yeah, great. Like, no, this sucks. So like, imagine just losing your baby and then knowing that just across from you, there's someone having a baby. And then when you're leaving, you often bump into these moms leaving with their babies and you're empty handed. And it's just like that is horrible. And again, like I don't know if they can allocate resources to that and they choose not to. Like, I don't think that's the case. I think, most hospitals don't have that. So you're having women delivering in the same units in most hospitals, from what I know. And like the nurses tried their best. Like we put a sign on the door. Like usually my hospital is a butterfly that like, so we know. So in case someone's covering you, you're not going to walk in there and be like, so how many weeks are we? Like, you're going to walk in there quietly and be very respectful. And depending how far along the baby is, so like this one, 25, that's a big baby. So she had to be induced. She had to receive oxytocin. She got an epidural. And I went in right after her epidural, because right after they get the epidural, we go and insert the urinary catheter. So I was still in my training. So my preceptor was back. At the nursing station. I went in, and as soon as I inserted, I see bulging membrane. So like the sac was already coming out, and I could already see the baby's head. And I was like, oh my God, like, don't come out. Like, I'm by myself here. Like, I don't know. I won't know what to do here. So I didn't say anything. I left, told the OB, and he came in and just burst the sac, and baby just came out like right away. Because I don't remember the exact weight, but maybe like, I don't know, 2 kilos, 1.5 kilos. And the mom was like, oh no, like, I don't want to see it. I don't want to see it. Because a lot of people are scared. Like, they don't know, is there going to be some malformation? You know, they don't know what to expect. So we took the baby and cleaned the baby and wrapped up the baby. And said, like, your baby looks perfect. Do you want to hold your baby? And she was like, I don't know. And I'm like, it's okay. Take your time. We'll take the baby to another room. And if you decide that you do want to see the baby, it usually helps with the healing process. You let us know. We'll bring baby back. So we brought it back, and, you know, they just broke down crying, and they held the baby for a little while, but then she called back. She's like, okay, no, like, I need you to take the baby away. And then, like, they asked to see the baby one more time after, but they're like, no, like, take it away. And we do like footprints, and if they have hair, we'll cut a little piece of hair, and we'll put like a little hat, and we take photos, which I've heard of different ways of doing this. One way is to take photos of the baby in water, because the baby starts to deteriorate very quickly. So it starts to look like a dead baby very quickly. And I thought the photos were, like, for lack of a better word, horrible. Like, I would not want to look at those photos if it was my baby, because it was clearly a dead baby. So I feel like it has to be done immediately or another way. So one nurse of mine, like a coworker, was telling me of this woman who takes photos of dead babies in water, because it helps the skin look a little bit better, like through a clear tub. And I'm like, that's brilliant, right? Like, that's so cool. But we don't have the resources. Like, we're using some like old digital camera in the hospital. And so we'll give them a little box at the end with photos, the footprints, little band, the little hat that they were wearing, all of that. And the thing with stillbirths, so after 20 weeks, and it's the same here, 20 weeks and over, or 500 grams and over, it's considered a stillbirth. So they need like a death certificate, birth certificate, or stillbirth certificate, depending on the area. And you have to have your baby cremated or buried. Like, it's considered like a person legally. And
unless it's an abortion.
Unless it's an abortion. Yes. That's a whole other can of worms. Like, when is it a person? Why is it a person at this point, but not at this point? And then they have to deal with that. And it's like, that's the last thing I want to deal with. So it's very like weird having to like have that chat with them and be like, you know, like, you are going to have to contact a funeral home. Like, the baby's going to go down to the morgue, and the funeral home's going to have to come get the baby. And if it's under 20 weeks, like, there's a mass grave in Toronto where those babies are usually buried. But I was looking recently, and depending on the jurisdiction, you can actually request to take your baby home if it's under 20 weeks, because it's technically not a person. So you can request it, but I think a lot of the time, like, nurses have no idea, because it's like not very common. So like, I don't even know exactly what the law is where I'm at. But in a lot of places, it's just like asking for your placenta. You can take your placenta home. Some people don't know that either. So in this case, you can take your baby home and bury it in your backyard. But like, it's such a delicate time and scary time, and people often prepare for birth and they do all the research for that, but no one prepares for death. And like Lisette, you know, talks about that like, if we made that more common and we talked about what that would look like, it would still be horrible. But we'd be like, yeah, okay, you know, at least we know. And like, I don't have to start thinking about that now that I'm going through this. And that's usually the case. Women are not prepared. And they're like, this woman, she was there, delivered her baby. And then as soon as the epidural wore off, she was like, no, I want to leave. And 2 hours later, I walked her out, like, try to walk her the other way, like, tried my best. Luckily, no one was walking by with their baby. gave her a hug, and off she went with her little box. And it's just awful, I think, in any capacity.
I think the one positive in that situation is when you are in the hospital, you do actually get given time to be with your baby, which is not something that is granted for women in other circumstances, maybe for home births, but definitely not that we've heard free births. So, yeah.
Which is, it's so messed up, right? And like, if someone free births a stillborn, and they think like, okay, we are going to go to the hospital eventually, but I'm just going to sit here with my baby for a few hours. Once they show up, you're going to be like, your baby was dead and you didn't come. You just sat with your baby.
Like, well, what are you going to do?
Yeah, exactly.
What were you going to do?
Like,
you're negligent again.
Yeah. It's just the disrespect.
But even if you have a live baby and everything's fine and you don't end up in the hospital
negligent.
until they're 5 years old, just needing stitches in your hand, negligence.
Yeah. Like, it's crazy. And I'm trying to figure out, because like, this is one of the points I was trying to make before and I lost track, that a lot of like the medical society, they won't even acknowledge women coming in who are alternative. There's like, oh, you're crazy, you're negligent, you don't care about your baby. So I'm trying to find a way to be like, hey, I went to nursing school and I work in the hospital, but like, I disagree with like everything you're doing. And like, have you guys looked at this? Like, how can we bridge that? Like, I want to go back and talk to my manager and be like, hey, do you know, like, are you aware that women are choosing to birth outside the system because they're terrified of coming in here because this and happens? And I can be like, with me personally, as a nurse that works here, like the way the pediatrician treated me because I didn't do this and that, which thought I should have.
And like, the negligence from the obstetrician who could be up to date with their breech birthing skills.
She was saying it's policy that she's not allowed. And
I recently actually asked, I mean, I don't know if this is the same in Toronto, but like I asked how policy and regulations are actually I'm researching for another interview. So I haven't fully polished on this yet, but I just asked somebody that I knew who was a midwife how they even make policy and procedure. And it's just a group of people. A couple of people get to decide that.
Yeah. And I don't think it's anyone who's actually working.
Like, no, they're
just sitting
at
like do mothers or anybody else get to decide how they're going to be? It's literally a group of doctors who get to decide on policy. And I'm guessing there's a lot of other like branches that influence that. And it just doesn't really seem like
and that's
that beneficial.
Like, we
for
don't
us.
know exactly like how are policies made and can they be changed? It's just kind of like, oh, we don't know. We're just not going to go there.
Yeah.
But it's like,
well, like even during COVID, like I had a baby that had needed to be transferred during COVID, like the thick of it. And like so many, there were a few nurses and lactation consultants who would come in and they were like, you know, like we'd obviously get chatting and then they'd clue on to the fact that I was very like anti everything. And they were like, yeah, I mean like low-key shut the door. Like I kind of agree. I'm like, but how do you agree? Because you're enforcing it. Like what's the deal then? She's like, oh, just policy. I'm like, yeah, but that's bullshit because you're actually treating me in a way that like down on the down low, you're like, go you. Like you're such a strong mama for being like, you know, a bit of a force. Yeah. But I'm sorry I can't like help you. It's like, well, hang on.
Yeah. And I think like I'm not scared to lose my job. So I think like I'm like I want to go back and I want to push back and I want to figure out like what can be done? Can something be done? Like who can we talk to? It's like, oh, I don't know. Let's find out. Let's do this together. Like you don't have to pay me. Like I'll show up for 12 hours. Like let's figure it out because women and babies, you know, they may die because they choose to be alone. And I don't think like most women want to be alone. Like why are women free birthing? Like is it because they don't trust the system? They're scared of midwives coming in and sabotaging their birth, or because they truly just want to be alone? Like would you guys who free birth, would you have liked if you had a midwife in another room, didn't come in at all? But if at any point, like if at any point,
unregistered midwife
there you go,
in another room, and if I needed it, it was there.
And did you feel like
it was great?
It was great, right?
Yeah.
Like
I didn't.
And how did you feel? Like
I I don't even want my husband there.
Okay. But like, or maybe even if they were like parked on the street.
Yeah.
Like,
No,
If
I
that-
think
there was
for
that
me,
option.
there would
Or
be-
someone in the
that would be
community
pressure.
would even be great. Like
Yeah.
just someone that you can call who is allowed to come. Because there's a lot of,
Yeah,
you
yeah.
know, like there's people in this community who are like, I could come, but you can't kind of like tell anyone.
yeah.
It's like, well, why not? Why the fuck not? Why can't you come and check on me
Yeah.
after I've just given birth? Because that's what you're trained to do.
Yeah.
Like the whole reason you probably
bullshit.
signed up for that job because you genuinely care about women, right?
But
Right.
imagine imagine that person checking on a woman because they've just given birth and they've not been across the case, or like they've just heard that a woman needs to be checked after birth. Imagine getting in trouble for going to.
That's
But
what
that's
I-
but
that's what
why?
I mean.
Why
It's
are
like,
they
why
going
are
to
they
get in
getting in trouble?
trouble?
Yeah, but that's it. Isn't
That's
But
what's
it's
happening.
yeah, that's what's
Yeah.
happening. And like, why? Why?
Mm.
Like, that's bullshit.
Mm.
And I hear a lot of the time on some stories that like, oh, like if you do this, your midwife will abandon you.
Yeah.
Mm.
And I don't know. I know it's
And
different
it does
everywhere.
happen.
It happens here too. Like
Yeah.
if you decline a certain test or
Yeah.
you do a test and it has certain markers,
Mm.
then you're no
You get
longer
kicked out of the home
eligible
birth. Yeah.
for a program.
So that's
or
the
you're like,
thing. Like if you do the test and you become high risk or something, then, you know, like, oh, now it's outside my scope. I can't be your midwife. But if you decline the test, like I did, then, and the ultrasound, like she didn't know I was breech, didn't know my GBS status, didn't know if I was, if I had gestational diabetes. So technically, so like, I don't know, in Canada, like nurses, you can't just abandon a patient.
well, I
like-
thought that was
You know?
like a law. Like when we were just doing some research for abortion, like, isn't it against the law to deny care to a woman?
Exactly.
Or to deny
Well,
care to
You
anyone?
can't just abandon a patient. Like that is against like the
Maybe-
regulations.
Maybe they can't abandon a patient, but what they do is enforce a lot harsher, more incredibly sinister procedures because they disagree with the way that you have chosen to go
Well,
down with things.
And I think, and my midwife would often say that she's like, oh, you know, she's like, I'm okay with you declining it, but if you had an OB, they would not be okay with it. So I think it also depends, like if it's midwife versus OB, what they're okay with, like how much they're going to push back. But like, I really wonder how much of that is true, like that they just abandon you, like, oh, you don't want to do it how I want it, sorry. Or if it's more like, okay, no, like I'm not allowed to attend you if we know
Like
you're breech or something.
legally, yeah.
But if you're just not doing any of the tests to begin with, like,
Yeah. There's a
They
way
can't-
to work through.
yeah,
with
like
the
they can't just
system.
abandon you.
Yeah.
And I think that's what needs to be happening. Like women need to be able to just choose, like, or like for me, they came, they were there for 15 minutes, the midwife, and then she left. And then the other one came 15 minutes. And that's when we decided to go to the hospital. But they weren't chilling there. So I think like women need that. They like, I want to be alone, but I'll let you know when it's getting close and maybe be within 20 minutes of me and come check. Like women need to be able to make that decision and decide like, you know what? I do want an epidural. I can't take this anymore. I'm going to show up at the hospital and not be scared. Like there needs to be a way because women are choosing to just not show up at all. And sometimes it's in situations where like their babies could have been saved. Or even the mother, like if they're hemorrhaging, but like, no, I'm terrified. I don't want to go there. I'm just going to wait it out. It's probably normal. It's going to be okay. Yeah.
Yaz, we are so appreciative of your time and your knowledge and insights. Thank you so much. I feel like we could have
problem.
probably continued talking forever. Birth
I
is just
know.
one of those things.
So much to say.
But thank you so much
No
for coming
problem.
in. We
my pleasure.
yeah, it was great.
Good luck.
Changing the system
I
from
mean, it doesn't
within.
sound like a big job, but I think you've got this.
Well, yeah, it's just like, you know, what could happen? I can
mean,
cook.
you
I'll
happen to
open
be
up a restaurant if anything.
You happen to be taking on like a hell of a city, I have got to say. Like Toronto is
Ugh.
not like on the scale of like, yeah, I could see change happening to like, it is bullet training in the opposite direction of change. Like
Yeah,
you're up there.
yeah, it's pretty terrible. So
But-
we'll see.
You could always become a midwife and
Yeah.
support women at home.
Yeah.
Well, in like Toronto, you don't have private midwives in
Oh.
Ontario the way you have it here. So you can only work like through like a midwifery group. Like
Yeah.
it's different. and it's OHIP, right? It's public health. So you can't just go and pay out a midwife the way you can here. So like,
Interesting.
it's, yeah,
I'm sure you'll figure it out.
I'll try.
All right.
Thanks,
everyone, for
ladies.
joining us. Bye.
Thanks for tuning in to the Road to Wisdom podcast. To join the journey, you can follow us on Instagram at theroadtowisdom.podcast and at www.theroadtowisdompodcast.com. Don't forget to subscribe and leave a review. We look forward to seeing you next week with more juicy content.